If you've ever noticed vaginal dryness, pain with intercourse, or frequent urinary tract infections, this video is for you. And if you've been told that vaginal estrogen isn't safe for you, stop scrolling. The latest research shows that vaginal estrogen can be safely prescribed to most women. Hi, I'm Dr. Yadawara. I'm a board-certified OBGYN, and I have been prescribing all forms of hormone replacement therapy for the past 30 years. My hope is that this video will help educate you and alleviate any fears that you might have about trying vaginal estrogen after menopause. The symptoms of vaginal dryness, painful intercourse, and frequent urinary tract infections aren't just normal signs of aging. There are treatment options available that are safe and effective and affect your quality of life. By the end of this video, you'll understand how vaginal estrogen works, who it's safe for, and what the latest research shows. After menopause, your ovaries stop producing estrogen, and this can affect the tissues that rely on estrogen, particularly the vagina and the urinary tract. This drop in estrogen can lead to a cluster of symptoms called the genitourinary syndrome of menopause, or GSM for short. The symptoms can include vaginal dryness, painful intercourse, burning and irritation, urinary urgency or frequency, and frequent urinary tract infections. You might think that these symptoms are just a part of getting older, but the truth is vaginal estrogen can help provide increased moisture, elasticity, decrease irritation, and even decrease the risk of recurrent urinary tract infections. Unlike systemic estrogen that circulates through your whole body, vaginal estrogen is applied locally to the tissues that need it and can be applied either by a cream, tablet, or a ring. Estrogen applied locally to the vaginal tissue thickens the vaginal lining. It restores the natural acidity to the vagina, decreasing the risk of urinary tract infections, and increases the moisture and comfort of intercourse. Because it's local, very little estrogen enters the bloodstream, and it's been shown that when it's used as prescribed, it doesn't increase the blood levels of estrogen, making it safe for most women. Recent studies continue to support the data that vaginal estrogen improves vaginal dryness and discomfort, reduces painful intercourse. It helps with urinary symptoms including urgency, frequency, and recurrent urinary tract infections, has minimal systemic absorption so it's safe for most women, and doesn't increase the risk for endometrial cancer when used as prescribed. But a newer study done by Mary Bestie and colleagues shows that vaginal estrogen may even be safe in breast cancer survivors. This study pooled the data from 8 observational studies and looked at between 24,000 and 64,000 women, showed that vaginal estrogen users had no increased risk of breast cancer recurrence or breast cancer death. I'm going to say that again. The Mary Bestie study showed that vaginal estrogen use was not associated with increased breast cancer recurrence. There was no increase in death from breast cancer in the vaginal estrogen users, and there was no increased risk of overall death from any cause in breast cancer survivors using vaginal estrogen. There is one caveat to this study though, and that is that it was the pooled data from 8 different observational studies rather than being a randomized controlled study, which would give it much more power. Because of this growing body of evidence, vaginal estrogen is now recommended as a first-line treatment for GSM. Most postmenopausal women can use low-dose vaginal estrogen unless you have untreated endometrial cancer or abnormal uterine bleeding. As a clinician, I advocate for shared decision-making. So if you have a history of breast cancer and you suffer from GSM, talk to your oncologist. I've included a reference slide at the end of this video, so bring a copy of the Mary Bestie study with you when you go and talk to your oncologist. So who can use vaginal estrogen? Vaginal estrogen is safe and effective for most women suffering from genitourinary syndrome of menopause. I tell my patients not to judge the full effect of vaginal estrogen until they've been using it for a full 3 months. Your tissues didn't become atrophic overnight, and they need to rejuvenate in an estrogen-rich environment in order for you to notice the full effect. Give it 3 months. Be patient. Some things to note: use it as prescribed. Some of the products ask you to start off with a nightly application and then decrease to twice a week. And certainly if you have any issue with abnormal bleeding or irritation, contact your doctor. For most women, treatment is very well tolerated and life-changing. Vaginal estrogen is safe, effective, but underutilized despite the evidence showing that it can affect a woman's quality of life after menopause. So if you've been struggling with painful intercourse, vaginal dryness, frequent urinary tract infections, talk to your doctor. If you're interested in learning more about the FDA's changes to estrogen's black box warning, I've done a video recently addressing just that, and I'll link that right here. Thank you so much for spending your time with me, and I hope that this video has been valuable.